Good morning, everyone. My name is Hannah Edlin. I'm the Policy and Advocacy Director here at Kentucky Youth Advocates, and we're so excited that you are here joining us virtually today for Cultivating Hope, the Kentucky Opioid Abatement Advisory Commission's latest funding opportunities. We will be recording today's session for those that may not be able to attend, so it will be available for viewing later. We're hoping today that you'll gain insight into how opioid settlements are being invested across Kentucky. You're going to gain information on the latest NOFOs, and there's going to be an opportunity for you all to ask some questions. To kick off our time together, I am going to actually kick it over to Barry Allen, one of our grant makers with the Bloom Kentucky Initiative. Through his thoughtful vision and leadership, Barry has galvanized coalition members from every corner of the Commonwealth in hopes to mitigate adverse childhood experiences through policy change. I'll kick it to you, Barry.
Okay, thank you, Hannah, and greetings and good morning to each of you, and thank you for participating in this important session. And on behalf of the Coalition of Grant Makers from across the Commonwealth, I also want to thank you for what you are doing on a daily basis to bring the light of hope into the darkness of despair of the children and families you are serving. It's so encouraging to know there is such a powerful constellation of human and financial resources coming together to wage and to win the war against the evils of child adversity and addiction. And I'm so grateful that among this constellation of resources is the Kentucky Opioid Abatement Advisory Commission and its leadership. We are indebted to Chris, Jesse, Hallie, and their team for their sensitivity to upstream thinking and for their action in the distribution of the funds to aid in winning this war. So Hallie and Jesse, we look forward to hearing from you. Thank you.
All right, at this time, I'll kick it to you, Hallie, to get us started.
Sounds good. Thanks. Good morning, everybody. Thank you all for joining us today. I'm gonna share my screen. Everybody seeing my slides? Okay. So good morning again. My name is Hallie. As Hannah said, I'm a grant specialist with the Kentucky Opioid Abatement Advisory Commission. And with us today, we also have Jessie Halliday. She will be here to help answer questions at the end. To start off with an overview of what are the opioid abatement funds. So Kentucky has received about $1 billion in abatement funds. And of those funds, of all the funds that come to Kentucky, 50% of them come to us at the state, at the AG's office, where the Opioid Abatement Commission distributes them via grants. And the other half of the funds go to local governments, they go to cities, they go to counties, and the state never sees those funds. So those funds go straight from the settlement distributors to the local governments. And all funds, whether they're at the local level or at the state level, have to be spent on opioid remediation. So prevention, treatment, recovery, substance use related programming or services. And as you all likely know, we have a commission, members who vote on the grants. So whenever we give out grants, those commission members are the ones who are voting on what grants will be distributed. So far at the state level, we've awarded a little over $85 million. Last year in 2025, we gave out 77 grants, almost 20 million. In 2024, 51 grants, a little more than 12 million. And right now we have another grant portal open, which we'll be talking about today. And so we'll see what comes from that. And I should mention that we also gave 32 million to fund SB 90 as well. So right now we have our 26-27 grant portal open. You can find those notice of funding documents that we'll review today there on our website. The link is here in the slides, and we'll make sure you all get these after. So we have two grant portals. For those who aren't familiar, we have a treatment and recovery portal, and we have a prevention portal. And all the applications will be due on December the 19th at 5 p.m. We also have a new grant that we haven't distributed before. It's the first time. It's the Research and Innovation Grant, and that is still open on our IntelliGrant system as well, and it's also due on December 19th. That Research and Innovation Grant is focused more towards how can we move the needle in Kentucky? How can we learn more about either a new programming or service or treatment, or learn more about how to retain people in recovery, how to prevent opioid use disorder. So it's less focused on those programming aspects that you think of when you think of treatment and recovery and prevention, and is more focused on research and innovation. So in order to apply for state funds, you have to have an IntelliGrants account. And this is a picture of what IntelliGrants looks like whenever you go to the home page. If you are not familiar with this or your organization doesn't have an account, you can go onto the home page and you'll hit new user register here at the bottom. And once you register, we will go in and approve your account. And that is where you will find all of our grant applications. And if you have any trouble getting an account set up, you can feel free to email me as well and we can troubleshoot. As for who can apply for funds, any registered entity that is in good standing with the Kentucky Secretary of State can apply for funds. That's for-profits, nonprofits, local governments, quasi-governments. We have provided grants to school systems, to hospital systems, to you name it, and we've probably given a grant of some sort to them. So we like to remind people that it's not just for nonprofits. So as I mentioned, there are two portals. There are treatment and recovery, and there is a prevention portal. So the first one, treatment and recovery, is focused on linking people to treatment or helping retain people in recovery, helping to build recovery capital. So this is less focused on that prevention aspect, which is more, education, and anti-stigma and preventing overdoses. This treatment and recovery is more focused on those people who are in active addiction and are looking to enter treatment, or people who are in recovery and are trying to maintain that recovery. And every year, the commission sets priorities for these grant portals. So this is a list of the priorities that have been selected for this year by the commission for treatment and recovery. And this doesn't mean that they won't fund something that's not listed in these priorities, but it does mean that when they're looking at the application, they are taking these priorities into consideration. And a lot of the priorities have been set by what we've heard at public comment sessions. So we had, I think, 3 or 4 this year where we just asked the public to come and tell us what is important to your organization. What do you think we should focus on in Kentucky? And this is a lot of the feedback that we got back. So one of them is treatment options that fill a need or service gap that isn't being met in the geographic area. We have a focus on supportive housing, transportation, employment, recovery community centers, family togetherness. And a lot of these are the same that were listed in the priorities last year, but there are 3 new ones, and those are programs that address opioid use disorder and co-occurring mental illness. We heard a lot about that in public comment session. The expanded use of peer support specialists and the expanded use of medication for opioid use disorder. So those are the 3 new ones that the commission decided to add to the treatment and recovery priorities for this year. The next portal is prevention, and I'd say that's probably the most relevant to the people in the room here today. But this is focused on prevention of first-time use, providing education on substance use to both adults and youth, and then assisting those who are unable to stop using drugs but are in active addiction, and providing those harm reduction supports to help people enhance their well-being and to keep their community safer. So the priorities that were chosen by the commission for prevention, a lot of these are the same from last year, but there are a couple new pieces that they added that are really important and likely are really important for this group today. So one of them is prevention of first-time youth, and this is youth focused in school or out of school, and the commission has defined youth as people below 26 years old. And then this is a new addition to the priorities this year, programs that increase access to positive youth experiences and use reduction of ACEs or adverse childhood experiences as a goal. That was something we heard a lot in our public comment sessions, and the commission felt that it was important to add it to our priority list. We also added parent, guardian, and adult focused substance misuse education. And then we have overdose reduction efforts, so naloxone distribution, mobile clinical services, etc. All of the grants are capped at 1 million. We did make a change this year that you can apply for either a 12-month grant or a 24-month grant. We, in the past, have only had a 12-month option, but whether you apply for 12 or 24 months, the cap is still $1 million. And if you decide to choose a 24-month grant and you are awarded that grant, you can't apply for a new grant until you're in the final year of that 24-month process. There can only be one fiscal agent per award, although we do encourage collaboration, and that is something we've seen a lot in the grants. You can only have one fiscal agent, so only one organization can physically receive the check or the funds. And then organizations can submit more than one application, but they should be substantially different. So if you decide to put an application in prevention and you decide to put an application in treatment and recovery, really think about how different those applications are. The commission, they're pretty savvy and they know if someone is trying to, just increase the cap by putting a similar application in both portals. So really think about how distinctly different those applications are, and keep in mind this isn't to discourage people from applying for both, but it will increase the competition if you put an application in both portals. And on that note, last year we received around $80 million in asks for grants and gave out around 20 million. So it is a pretty competitive process. So what does the commission look for whenever they're assessing the applications? They're looking for projects that demonstrate strong collaboration. So how are you working in your community? How are you working with other organizations in your community? Be sure to talk about that in your application. They're looking at projects that expand or enhance service opportunities. So we do discourage supplanting, which is essentially taking one pool of funding that you already have funding for this project, but you're going to use opioid abatement funds instead. So we look for the expansion of projects rather than replacing one funding source with opioid abatement funds. And then we look for organizations that have strong sustainability or that can eventually move away from opioid abatement funding. We do ask some of you on the call, if you've received grants before, you're aware of this, but we do ask that if you are applying for continuation funding, you have to decrease the amount that you were awarded by 25%. So if you're applying for a project that is pure continuation, you have the same goals, the same exact funding, you need to decrease that by 25%. But if there is some sort of hybrid, we're doing some continuation, but we're also expanding, you don't have to ask for that 25% reduction on those expansion pieces, only on the continuation pieces. What is not allowed? Funds can't be used to purchase land. They can't be used for construction or to secure any permits related to construction or renovation. They can't be used to purchase vehicles, but the commissioners will think about, if you need transportation support at your organization and you have some creative way that you've thought of, whether that's providing bus passes or providing Uber vouchers, that's not prohibited, but the actual purchase of vehicles is prohibited. And some of these we've already covered before. As we said, multiple agencies can partner in the application, but only one can be the fiscal agent. And you can submit multiple applications. Just make sure they're distinctly different from each other and that they will be competing with each other as they're all reviewed collectively. And these are just some helpful suggestions that we like to give people as they're preparing their application. One is tell a strong story. So what gaps are you addressing in your project? Why is what you're doing different from what other people are doing? And why is this needed in your community? And how do you know that? Be sure to talk about the partnerships that you have in your community. Who do you work with? Are you a recovery ready community? Have you supported that recovery ready community certification process? And then show why your work is a good investment. Make sure you explain, your financials, that whenever the commission reads your financials, there aren't any questions lingering. If there are, we have a narrative section and a lot of throughout many pages of the application. If there's anything that needs to be explained, you have plenty of places to explain it. So please do that so that the commission is fully aware of your financials. And I think that's all I have. I'd like to open it up to questions if anybody has any. And here are Jesse and I's emails if you have questions after. Thank you all.
Thanks, Hallie. Wonderful presentation. At this time, I'll open it up to anyone that may have questions. Feel free to drop those questions in the chat, or if you'd like to come off a mute and ask your question, you can do so as well.
Hello, my name is Ladessa Lewis, and I am with Meant to Be here in Christian County, Hopkinsville, Kentucky. And my question was, I know that we would probably go for the preventive part of the grant, but the other, I can't remember what it was, but I did see, did it say something on there about a community center or something like that, that
On
funds?
On treatment and recovery, we have recovery community centers, which are specific centers listed as priorities. That might be what you're referencing.
Yes, and I did see on there as well as it said that you couldn't use these funds to like build or construct or anything like that. I do know that we have been gifted the historic school attics, and that is something that we wanted to put there was a community center and have those different resources in there. So that I just want to clarify that's not something that could be used for. It has to be something that's already ongoing or
It
something.
could be a new project if it hasn't been developed, but it can't be for the construction or the renovation of the building itself.
Okay.
So you could ask for funds to support a new community center. They don't have to be existing. It's just the construction or the purchase of a land or a building.
Okay, we already are the owners of it, but like I said, it's been sitting for a while, so it has to be renovated to, to be able to do that. So,
I
thank
mean, there could potentially be small renovations, but if you were going to do the level of renovation that required permitting and city approval, like it needs a whole new plumbing system and that
you.
requires permits, that's not allowable under the fund. Some small renovations or requests for furnishings, those have been requested. They don't always get funded,
Okay,
but that is an allowable ask.
okay, thank you.
I'll add that you could also consider, as we mentioned, there are local governments that have opioid abatement funding, and they don't necessarily have those restrictions of construction and renovation. They might, but it would just be something that you would need to ask your local fiscal court, and maybe they could assist with it as well.
Thank you.
There are a couple questions in the chat. Jim asked, are there page limits on the narrative?
In the research and innovation grant, there are some page limits that we've set, but in the prevention and treatment and recovery grant, there aren't. There's one section that has a character limit in sustainability, but the rest of the narratives, they don't have page limits. So.
And another question is, in the prevention proposal, are stipends to youth for participation allowed for scholarships to participate in activities?
They are allowed, whether the commission will fund it or not, that is an allowable ask. So I always suggest for people to make sure you include a strong justification if you're asking for stipends for participation. Why is that necessary? What is your participation rates if you don't have those kinds of opportunities? Or if you're asking for things like t-shirts or things that somebody might interpret as would be nice to have, but not essential to doing the program, put in justifications around why a t-shirt is an incentive or why it is necessary for branding or those kinds of reasons behind things that anyone might go, oh, well, that's not really necessary to run the program, but you're asking for it, make sure you've included your justification for why you're asking.
Hi, good morning. Thank you so much for this opportunity to connect with you all and learn more about the opportunity. I just wanted to, I think, kind of follow up with that last question. Like, are partial awards ever given? So if there were some expenses that the commission wasn't excited about and others that were, yeah.
Yeah, I can share a little bit about how we do our review process. So the commission is separated into two work groups for the purpose of reviewing. So you have a treatment and recovery committee and you have a prevention committee. Each of those committees will review the applications that come into the portal that corresponds with their committee. They will, those are closed session because they are related to contracting. So they go into executive session to have the conversations about the review. During that time, they may decide they want to, they're just automatically know they're not going to fund that project. So there would be a rejection of that application in those committee meetings, or they're going to determine that they'd like to move it forward for the full commission's consideration. As part of that process, often what happens is they are trying to stretch the dollars as far as they can. So we like to refer to that as you made like the first round of, we'll call you back and we'll have a conversation with you. And so that'll usually be me and Hallie or some combination that are making those phone calls that say, like, the commission really likes what you've got here. They need to see if you can reduce your ask, or they don't want to fund t-shirts or whatever it is. Are you comfortable resubmitting the grant with a lesser ask or with these things removed? Does that inhibit your ability to do it? We'll give you time to revise your application ask and we'll take it back to the committee. That doesn't necessarily mean it's going to come out of committee to the full commission, but at least it's going to get a second look. And then we will, and anything that comes out of the committee goes to the full commission for a final vote at the end of the process.
Thank you. That's so helpful.
Got a few more questions in the chat. Kara asked, could we use funding to retrofit a bus as a mobile outreach behavioral health clinic? The bus is owned by the agency.
That would be an appropriate ask, I think. Yeah.
There's another question by Connie. Could grant funds be used to hire licensed mental health therapists for a school district as part of a multi-tiered system of supports to address ACEs as a means to prevent substance abuse?
That is also an allowable use. Yeah.
I believe it's Rafina. Feel free to correct me. The question is, if we're requesting a 24-month grant, how should we reflect that in the budget in the system? For example, on the staff salary section, we provide an annual cost, but I'm not sure how to reflect that we're requesting the salary for 2 years.
I would say that in the budget section where it asks for the salary, instead of just putting what you're paying them for a year, you can go ahead and put in the amount of what it would be for 2 years. And then in the narrative section, you can explain that their annual salary is X amount, but you listed double that amount because you're going to be paying their salary for 2 years.
Right, because you have to check at the beginning if you're doing a 12 or a 24-month budget. So we're expecting that in the budget section, if you've checked 24 months, your totals are for that 24-month period.
Great questions. Hallie, could you clarify the number of pages for the narrative again?
Yeah, there are going to be page limits on the narrative in prevention or the treatment and recovery grant. There is a character limit sustainability question, but I believe that's the only question that has any sort of character limit. And the narrative, they do have, like IntelliGrants as a whole has a a cap on what you can submit, but the page number for that is extremely high, so I don't imagine anybody will hit that limit.
And you can include as many uploads as you'd like for the prevention and treatment recovery grants.
We do have them restricted to PDF uploads only, so if you try to upload a Word document, it will tell you that it doesn't accept that format, so you'll just need to convert it into a PDF.
It will upload in Excel though, right, Hallie?
Um, the narrative sections on most of the pages are only PDF, but we left like the financial sections as Excel too. So yeah. And if you run into an issue where it won't let you upload something, you can email me and we can work through it.
Great questions. Are there any other questions?
Hello, everyone. My name is Melissa McDonald. I'm with World Affairs Council of Cincinnati and Northern Kentucky. Thank you for being here and for sharing this information. It is really important to our community. I am curious about, could funds be used for staff? I guess it kind of is answered if you can fund a therapist. So staffing costs can be included in the budget. And what is the minimum amount that is usually awarded as well?
The minimum amount we've had, we've had grants as small as $4,000. So there's not a you know, a minimum. We will consider any proposal that comes in under $1 million. I always like to make a caveat that very few $1 million grants have been awarded. And most of those grants happened in the first year prior to us taking office in 2024. There wasn't a cap listed at that time. And it's really difficult for most organizations. We found even in those $1 million grant awards, it took 18 months at least for those organizations to spend the $1 million. So the commission really considers that. And so I like to mention that, because if you want to apply for a 12-month grant and ask for $1 million, not that it wouldn't be awarded, it's just it's not as likely because of their past practices and knowing how difficult that is to spend down to get everything up and running. We do advance payment. So that is something that a lot of people have asked about. Like, if you are given an award, you will get an immediate payment for either 6 months for 6 months of your grant cycle, whether that's 12 or 24. So if you're doing a 24-month grant, you're going to get 4 different payments over time. It's not all going to come to you up front. And staffing is probably the biggest area that we fund for all of these projects, our staff requests.
And then you mentioned, thank you, appreciate that. That's very helpful. You mentioned collaboration. Can it be collaboration between more than 2 organizations? So 3 could combine together?
Yes, you can have any number of sub-grantees that make sense for your project. You just have to have a clear articulation of who's managing the funds and how they'll go out. Because you can only have the one fiscal agent. And I just also want to stress that this year, the commission has added that if you are having a collaboration, you must include some documentation of that collaboration, a letter of support, an MOU, something that shows that that partner is 100% in on the project. We know sometimes we think we're going to have partners and we need to do the work. They just want to know that that work has been done on the front end so that everybody's on board to get rolling as soon as you can get the funds.
No, that's great. Thank you. And then one final question is, could funds be used for marketing, since that's really crucial to getting people to activities, especially young adults that maybe aren't in school and have as much access?
It is an allowable use, and I will say we have funded it and we have also cut it from budgets in that process. So just, again, it really goes back to you making the case and how much you're asking for and sort of how you, like, what kind of strategic marketing plan do you have? I will say that they don't like to see big line items like $50,000 for marketing with no description about how it would be used. So, and that's true for everything, supplies, for operational expenses. The more detail you can give about what that money is going to get allocated to, even in a general way, like you may not have bids and know that it's going to be $2,000 for this thing, but the more detail you can give about how it'll show that you've thought about the cost of things. And but marketing is one of those areas where it gets funded sometimes and it gets cut sometimes, just depending on how much and the justification that's given.
Super. Thank you so much. Really appreciate it.
So I see the question in here about supplanting. So the commission discourages supplanting, and that's listed in the NOFO. The caveat to that really is like, if you've lost a grant and there's no source of funding for something that you've previously funded, that they don't consider that supplanting. What they don't like to do is replace budgets that are ongoing and basically start funding things that would have been funded anyway. The commission really wants to fund and seed new projects and new expansion, things that are new and haven't been funded all along for years. So, we are asking this year about loss of funding because we know the funding climate is different this year in terms of what might be available. So if you had a federal grant, for example, and that federal grant was canceled, that's not considered supplanting. You're trying to find a new source of income that you lost. So they don't consider that supplanting. But if you're a local government, for example, that has always had a harm reduction program in your public health department, and you simply want to use these funds to keep doing exactly what you've always been doing, they do consider that supplanting and are less likely to fund it. Does that help, Lindsay?
Are there any final questions before I wrap this up? Awesome. Well, thank you so much, Jesse and Hallie, for being here with us today, and the entire Opioid Abatement Advisory Commission for all of their work. My name is Corinna Cash with Kentucky Youth Advocates, and I am going to close us out by sharing a few resources. First, Kentucky Youth Advocates recently updated our opioid data dashboard on children and families. For those unfamiliar, the opioid data dashboard on children and families is full of local level data on how the opioid epidemic has impacted children and families, as well as innovative solutions that Kentucky communities have implemented to address the opioid epidemic and reduce substance use. Data includes things like ACEs and PCEs, chronic absenteeism, drug use in school, and accidental ingestions by young children, and so much more data around opioid abatement. This new update includes a beautiful new design and updated contextual information, such as new videos and texts that break down how various data points connect to opioid use or provide more context on how local communities are using funding. We invite you to explore the dashboard and consider how this data can guide efforts in your community. In addition to this dashboard, Bloom Kentucky's website also has so many resources on opioid abatement. This includes a toolkit that communities can use to guide their opioid abatement planning and applications, flowcharts on how funds are distributed, and more. All of these resources, as well as a recording, will be included on a follow-up email, so be on the lookout for that. And then finally, thank you so much to all of you who spent your morning with us. Together, we can cultivate a commonwealth where all children and families can thrive.